My name is Dr. Sarah Bein, and I'm a psychiatrist. So I'm very familiar with plasminogen deficiency because I myself have been a plasminogen deficiency patient. So with any chronic illness, it's so important to take into account the emotional and psychological effects of that illness. So with plasminogen deficiency, one of the main things to think about is how these patients feel to be different from other kids. As you can imagine, these patients, they feel different from other people, but oftentimes they look different too. And especially with plasminogen deficiency, there can be teasing and other kids can be making fun of you. And as we all know, that can lead to social isolation, depression, anxiety, feelings of low self-esteem, and insecurity. It can be a very traumatic thing to be picked on for something that is not under your control. Another way that patients can feel different with this condition is, because it is a chronic illness, oftentimes to remove these lesions, patients are undergoing near constant procedures and surgeries to remove these lesions. And so their life is very different from that of a child who doesn't have that condition. They're often wondering when their next surgery is going to need to be, when their next procedure is. They're spending, sometimes every day at doctor's offices, and that can just really make you feel very different than someone else who doesn't have to worry about those things. And that can just be very stressful, not to mention the medical trauma of repeated procedures. Another thing to think about is how it feels to live with a very, very, very rare condition. And oftentimes with plasminogen deficiency, patients who are presenting to doctors, that's the first time a physician has seen a case of plasminogen deficiency and may not even really know what they're looking at, how to treat it. And certainly that patient is going to be the first patient in that community. And that can be a very difficult, stressful situation. So plasminogen deficiency can very much affect patients' relatives and friends. If you think about anyone going through a chronic illness, I think it's very difficult for family and friends, for that matter, to watch someone you love struggling, to watch someone you love suffer with something that is beyond your control. And very much with this condition, with plasminogen deficiency, patients, families, and friends are really helpless to do anything. Something also that I think is important to touch on is when these patients have manifestations of the illness that make them look different than other people. It's a factor, when you're with someone like that who's being teased or picked upon, or people are staring, that can be a stressor for the whole family, just to have a member of the family who's a little bit different, and can be a difficult situation for other siblings, a difficult situation for friends, and can just overall increase, worry and stress. So for recommendations for patients and families who suffer and struggle with plasminogen deficiency, I would say the most important thing is to learn to be your own advocate. So to me, what that looks like is getting to know absolutely everything you can about your condition. A lot of times in the landscape of a very rare disease, patients must be their own advocate, even with their own physician. But sometimes doctors really don't even know what they're looking at and don't know much about the condition. So we as patients must be our own advocate in charge of our care. Another thing that I think is very important is to learn to develop your identity separate from being a patient. This is very difficult, especially with a disease as complicated and as all-encompassing as plasminogen deficiency, where really your day-to-day life can be consumed with your symptoms and doctor's visits and procedures. And one of the things that I think really helps is fostering close relationships with people who are supportive and loving and can just walk with you, on your journey. Also trying to engage in hobbies and things that interest you, just to help develop friendships and connections, is very important. And I would just say to the patients and families out there, if there's something that you love, pursue it and don't be afraid. I know that's a lot easier said than done, but as someone who has personally walked this journey and was very fortunate to have a loving family and great friends with me, it's life-altering when you can push yourself physically and just devote yourself to something that's going to make you feel as though your life is not completely taken over by an illness. For me, when I look to the future, I really just look forward to the hope that awaits people, and just being able to tell them that hope is coming, and be able to assure parents that though their child is suffering, it won't be for long.